Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Question number first, three muscles of hip, the obturator externus and gemellus are inserted on the dash fossa in the ox. Option A, temporal fossa. Options B, tympanic fossa. Option C, trochanteric fossa, or option D, obturator fossa. The right answer is option C, that is a trochanteric fossa. Okay. Three muscles of hips, that is the obturator externus, obturator internus, and gemellus, are inserted on the trochanteric fossa in the ox. Okay. Let's see the muscles of the which is located on the medial aspect of the thigh, actually arranged in three layers. That's superficial layers, and there's a middle layers, and there's a deep layer. If we see that superficial layers, we found there's a two types of muscles, that's sartorius muscles and there's a gracialis muscles. The sartorius muscles is the longest muscles in case of human being. Okay, if we see the origin of the sartorius muscles, then it's a shaft of ilium, zoes minors, and iliac fascia. And the insertion of these muscles is inserted at that medial patellar ligament, medial aspect of the proximal end of tibia, and there's a fascia lata. Second muscle is gracialis muscles. If we see the origin of this gracialis muscles, then it is pelvic symphysis and prepubic tendon. And the insertion of this gracialis muscles is that medial patellar ligament, medial aspect of that proximal end of tibia, and there's a fascia lata, which is same as to the sartorius muscles. Okay. And if we see that's middle layer of the that thigh muscles, okay, then we found there's a three types of muscles. There's a pectineus muscles, adductor muscles, and there is a semimembranous. Okay, the origin of this pectineus muscles is ventral surface of the pubic and the prepubic tendon, and insertion of this pectineus muscles is that posterior surface of femur at the distal end, and there's a medial patellar ligament and medial tuberosity of tibia. Okay, and if we see that's adductor muscles, the origin of this adductor muscles is pelvic symphysis as well as ventral surface of pubic and ischium. Insertion of this adductor muscles that inserted at distal end of the femur, that is a posterolateral aspect and supracondylate crest. Okay, and in case of semimembranous muscles, the origin of semimembranous muscles is ischial symphysis, ventral surface of ischium, and ischial tuberosity. This semimembranous muscles inserted at that area which is above the supracondylate crest and the medial tuberosity of tibia. Okay, the last layer is a deep layer. If we see the deep layer of these thigh muscles, then we found there are four types of muscles, that is quadratus femoris muscles, obturator internus, obturator externus, and gemellus muscles. Okay, the origin of quadratus femoris muscles is ventral surface of ischium, and this quadratus femoris muscles inserted at trochanter minor and posterior surface of femur close to the trochanter minor. Okay, and obturator internus muscles originated that at ischium and pubic at their pelvic surface, inserted at trochanteric fossa of the femur. Similarly, obturator externus also inserted at trochanteric fossa of the femur, and gemellus also inserted at trochanteric fossa of the femur. But the origin of that obturator internus, that is a ischium and pubis at its pelvic surface, externus that ventral surface of ischium and pubics. Okay, and while gemellus originate the ventral surface and lateral border of ischium and the posterior part of the sacrosciatic ligament. Okay. Question number second. The prostate gland in the bull has got two major division, corpus and pars. Option A, disseminata. Options B, quadrigemina. Option C, chordata. Options D, dorsalis. The right answer is option A, that is disseminata. The prostate gland in the bull has got two major division, that is corpus and pars disseminata. Okay. This prostate gland is a fibromuscular gland, which is actually situated at the neck of the bladder and at the beginning of the urethra. Is mainly composed of a glandular alveoli. Okay, and this whole prostate gland is covered by fibromuscular capsules, from which that band arises, and this band enter into the gland proper, forming a meshwork. Okay, although it is said that the prostate gland has two lobes, but the lobulations are not distinct in case of a prostate gland. The dorsal surface of the prostate gland is actually related to that rectum, while the ventral surface of the prostate gland is related to urethra, and there's the neck of a bladder. Okay, if we see that average craniocaudal length of this prostate gland is 2 centimeter, the transverse length of this prostate gland is 6 centimeters, and thickness is about 1 centimeter. Okay, and number of that prostatic duct that drain the secretion of this prostatic gland into the urethra. Okay. Questions number 3. The splenic artery of the ox arises by a common trunk with option A, right ruminal artery, options B, left ruminal artery, option C, abomasal artery, options D, celiac artery. The right answer is option A, that's the right ruminal artery. Okay. The splenic artery of the ox arises by a common trunk. We all know that splenic arteries arises from that celiac artery, which is the largest artery from that abdominal aorta. Okay, and it arises along with the right ruminal arteries. And if we see that's branches of this celiac artery, then we found there's a phrenic artery, splenic artery, right ruminal artery, left ruminal artery, hepatic artery, and there's a left gastric and abomasal artery. Questions number 4. The sciatic nerves continue as option A, internal popliteal nerves, options B, superficial popliteal nerves, option C, posterior cutaneous nerves, options D, tibial nerves. The right answer is option A, that's internal popliteal nerves. Okay, the sciatic nerves continues as internal popliteal nerves. Okay, the sciatic nerves just reaches the popliteal fossa, continue as internal popliteal nerve. It's first divided into two important branches, that's tibial nerve and a common peroneal nerve. Okay. Questions number that's a 5. The cells occurring in the organ of Coti and anterior epithelium of lens of eye are simple dash type. Option A, pseudostratified. Options B, columnar. Option C, cuboidal. Options D, transitional. The right answer is option C, that is a cuboidal. The cells occurring in the organ of Coti and that anterior epithelium of lens of eye, that's a simple cuboidal type cells. Okay. The pseudostratified epithelium is mainly found in a trachea. Transitional epithelium is mainly found in urinary bladder. We see that brush-bordered epithelium, columnar epithelium, is mainly found in intestinal tract, responsible for absorption. Okay. Simple squamous epitheliums are mainly found in that parietal layer of Bowman capsules. Simple columnars line that endometrium of uterus. Ciliated columnars line oviduct and respiratory tract. There's a note that the connective tissue capsule of that lymph node is mainly composed of collagen and elastic fiber. Okay. Questions number 6. The trilaminar cell membrane consists of two peripheral dense dash layer and light central phospholipid layer. Option A, protein. Options B, lipid. Option C, glycolipid. Options D, phospholipid. The right answer is option A, that's a protein. Okay. The trilaminar cell membrane consists of two peripheral dense protein layer and there's a light central phospholipid layer. Therefore, it is known as that sandwich model, where that lipid layer is lied between the two that protein dense layer. Okay. Questions number 7. The collagenous fiber of connective tissue stain dash in the Mallory trichome stain. Option A, violet. Options B, pink. Option C, red. Options D, blue. The right answer is option D, that is a blue. Okay. Mallory trichome stain, which is also known as Mallory triple stain, actually uses three stain, that is aniline blue, acid fuchsin, and orangey. That reveals collagen, ordinary cytoplasm, and RBC. Okay. Uh, Okay, reticular fiber take actually silver stain. Therefore, it is also known as agriophilic fiber. Okay, agrio terms stand for silver. Okay, so philic means love. Okay, and note that H and E stain, which is a hematoxylin and eosin stain, when stain the cells, then nucleus take bluish black color, cytoplasm takes pink color, while RBC take orange red color. Okay, while muscles fibers take that reddish violet color with H and E stain. Okay. There is that another thing, that's elastic fibers take dark brown purple color with orosine dye, while take blue black color with that resorcins fuchsins dye. Okay. Questions number 8. Gammon do not produce gamete in blood of men because option A, they fail to get appropriate temperature. Options B, they fail to get right nutrition. Option C, they fail to get oxygen. Options D, all. The right answer is option A, that is they fail to get appropriate temperature. Gammons gammons produces that gamete actually in that animals, but they do not produce gametes in case of in blood of a man, because they fails to get appropriate temperatures. Okay, therefore. Questions number 9. Mesodermal tissue made up of adipose tissue is called option A mesoglia, options B mesenchyme, option C botryoidal tissue, options D none. The right answer is option C, that is a botryoidal tissue. Mesodermal tissue, which is made up of adipose tissue, that is also called botryoidal tissue, is actually found in Hirudinea, that is a leech family of phylum Annelida, is mainly consist grapes-like masses of cells, which mainly containing brown pigment, and it serve as an excretory function. Okay. While mesenchyme is that type of loosely organized animal embryonic connective tissue of undifferentiated cells that give rise to most tissue, such as skin, blood, and bone. While mesoglia is a gelatinous substance between which is located between that endodrome and there's an ectodrome of cylindrid. Okay. Questions number 10. Malleolus is option A, knee prominence, options B, larynx prominence, option C, femur prominence, options D, prominence at end of tibia. The right answer is options D, that is prominence at end of tibia. Malleolus is the bony prominence, which shape likened to like hammerhead like shape. It is located at the distal end of fibula or tibia. Okay. Questions number 11. Gorilla ribs is option A, extra floating ribs, options B, extra false ribs, option C, extra true ribs, options D, first false ribs. The right answer is option A, that is the extra floating ribs. Gorilla ribs is extra floating ribs. Okay. Questions number 12. Crista galli is related to which bone? Option A, temporal bone. Options B, ethmoid bone. Option C, frontal bone. Options D, none. The right answer is option B, that is the ethmoid bone. The crista galli is actually thick, midline, smooth, triangular process which is arises from the superior surface of the ethmoid bone. It's projecting into the anterior cranial fossa. It separates the olfactory bulb which lie on either side of it in the olfactory fossa of the cribriform plate. Okay. Questions number 13. The articulation between the root of the teeth in the alveolar socket are termed as option A, skin dialysis, options B, syndesmosis, option C, gomphosis, options D, none. The right answer is option C, that is gomphosis. Okay. Uh, Gomphosis, the fibrous mobile peg and socket joint, we can see the root of teeth, which is known as a peg. It's fit into that alveolar socket, which is located in mandibles and maxilla. Okay, while syndesmosis is a fibrous joint in which two adjacent bone are linked by a strong membrane or ligament. Okay, syndialysis is an articulation in between two bone are joined by fitting the ridge of one bone into the groove of another bone. It is also known as wedge or groove joint. Questions number 14. Middle ear is situated in option A, preoptic, options B, pre preotic, option C, prootic, options D, tympanic bulla. The right answer is options D, that is a tympanic bulla. Middle ear is situated in tympanic bulla. Okay. Questions number 15. In which condition muscles remain in a prolonged contraction state? Option A, concussion. Options B, muscle twitch. Option C, tetanus. Options D, poliomyelitis. The right answer is option C, that is a tetanus. Okay. Conditions in which muscles remain in a prolonged contraction state, that is the condition is a tetanus. Okay. In case of that traumatic brain injury, which is mainly caused by a bump, blow, or jolt, or a head, or by a hit to the body that cause the head and brain to move rapidly back and forth. Okay. In case of muscle twitch, that is the fasciculations, occurs when the that innervations from that peripheral nervous systems to the muscles is not working correctly at the time this twitching scenes. Okay. Poliomyelitis is a condition where the paralysis occur due to the infection of the spinal cord by means of poliovirus. Okay. Questions number 16. A coronial suture is between which of the following? Option A, parietal and frontal. Options B, parietal and occipital. Option C, parietal and temporal. Options D, frontal and temporal. The right answer is option A, that's the parietal and frontal. Coronial suture is that suture which is located between frontal and parietal bone. Lambdoid suture is that suture which is located between parietal and occipital bone. Squamosal suture is a suture which is located between temporal and parietal bone. Okay. Questions number 17. Motor unit of gastrocnemius has option A, single muscle fiber, options B, 100 muscle fiber, Option C 1900 muscle fibers. Options D 2 to 3 muscle fibers. The right answer is option C, that is a 1900 muscles fiber. Motor unit of gastrocnemius has 1900 muscles fiber. Okay. Questions number 18. Solid mass of blastomere is called option A morula, options B blastula, option C gastrula, options D neurula. The right answer is option A, that is a morula. Okay. Solid mass of a blastomere is called morula, while that hollow sphere of cells, which is where there's a presence of that blastocele, that's a fluid filled cavity, and there's a covering which is known as blastodrum, epithelial covering layer, that's blastodrums. Okay, that is known as blastula stage. Okay, and that blastula stage moving forward to that another stage, which is where there is a hollow cup shaped structure which having three layers of cells, that is ectodrums, mesodrums, and endodrums. That stage is known as gastrular stage. Okay, neural stage is that further stage of advanced stage of that gastrulations, where the nervous tissue begins to differentiate it and a basic pattern of a vertebrate begins to emerge. Okay, neural stage. Questions number 19. Penile urethra transverse through option A corpora cavernosum, options B corpora spongiosum, option C corpus callosum, options D corpus striatum. The right answer is option B, that is a corpora spongiosum. Penile urethra transverse through corpora spongiosum. Okay. Questions number 20. Scrotum is absent in male of option A bat, options B utter, option C monkey, options D seal. The right answer is option B, that is utter. Okay. Scrotum is absent in male of utter. Questions number 21. Which of the following increases the surface area in ileum? Option A valvuli coniventi, options B villi, option C microvilli, options D all. The right answer is option B, that is villi. Okay. Villi increases surface area of ileum. Okay, increases the surface area, the higher rate of absorption. Okay. Questions number 22. Gallbladder is located on which part of liver? Option A right central lobes, option B caudate lobe, option C left central lobes, option D Spigelian lobes. The right answer is option A, that is the right central lobes. The gallbladder is a small hollow intraperitoneal organs which is located on a visceral surface of livers between the right and quadrant liver lobes. Okay. Questions number 23. Median crest presents on option A femur, options B tibia, option C radius, options D ulna. The right answer is option B, that is tibia. Median crest presents on tibia. Okay. Questions number 24. Egg of mammals lack which egg membrane? Option A primary, options B secondary, option C tertiary, options D all. The right answer is option C, that is a tertiary. Okay. If we see that's egg, then we found there's a three type of egg membranes. There's a primary egg membranes, secondary egg membranes, and there's a tertiary egg membranes. Okay. Primary egg membranes itself derive from that protoplasm of egg, and they differentiated into vitelline membrane, fertilization membrane, and there's a jelly-like layers that external to the vitelline membrane. Okay. While a secondary egg membrane is formed by that follicle cells such as a chorion. Okay. And tertiary egg membranes is actually derived from that the secretion from the one that's oviduct. So mammalian egg lacking this tertiary egg membrane. Okay. Questions number 25. Which of the following part of spermatozoon arises from centriole? Option A apical cap, options B head, option C middle piece, options D axonema. The right answer is options D, that is the axonema. Okay. Part of spermatozoa arises from the centrioles, that is axonema. Okay. Questions number 26. The musculospiral group is present on the dash surface of dash bone. Options A lateral humerus, options B lateral femur, option C medial humerus, options D none. The right answer is option A, that is the lateral humerus. Okay. The radial groups or musculospiral groups, or we can see radial sulcus or spiral groups, is a broad but shallow oblique depression for the radial nerves and a deep brachial artery. It is actually located on the center of the lateral border of the humerus bone. Okay. Questions number 27. The glenoid cavity of scapula is dash in outline in ox and oval in dash. Option A oval camel, options B oval goat, option C circular horse, options D none. The right answer is option C, that is a circular and horse. Okay. The glenoid cavity of scapula is a shallow circular in case of ox, while oval in case of horse. Okay. Questions number 28. Muscles sartorius consist of dash head. Option A 1, options B 2, options C 3, options D 4. The right answer is option B, that is a 2. Okay. Muscles sartorius consist of two head. Okay, and we also know that the sartorius muscles is the longest muscles in case of human body. And if we see that's origin of the sartorius muscle, then it's the anterior superior iliac spine of the pelvic bone. It is inserted at anteromedial surface of the proximal tibia in the pes and serenus. And the artery and nerves which supply to the sartorius muscles is femoral arteries and femoral nerves respectively. Okay. Questions number 29. Bronchial artery is the dash blood supply to lungs, while the dash artery is the functional blood supply to the lungs respectively. Option A pure and pulmonary, options B impure pulmonary, option C pure and same, option D impure and same. The right answer is option A, that is a pure and pulmonary. Bronchial artery is the pure blood supply to the lungs, while the pulmonary artery is the functional blood supply to the lungs. Okay. Questions number 30. Utero-ovarian artery is the branch of option A abdominal aorta, options B celiac artery, option C internal iliac artery, options D external artery. The right answer is option A, that is abdominal aorta. Utero-ovarian artery is the branch of abdominal aorta. Let's see the some branches of abdominal aorta. Then it's a celiac artery, which is the largest branch of abdominal aorta. There's a cranial mesenteric artery, and there's a renal arteries, testicular ovarian arteries, lumbar arteries, and there's a caudal mesenteric artery. Okay. Questions number 31. In which species are RBC of oval shape? Option A cattle, options B horse, option C camel, options D pig. The right answer is option B, that is a horse. Okay. Different shape of RBC of different species. In case of dog, cow, sheep, that's markedly biconcave shape. Horse and cat, that's a shallow concave, that's oval shape. In case of goat, that's a very shallow or flat surface erythrocytes. Camel and deer is elliptical and sickle shaped. In case of amphibians and birds, is elliptical and nucleated shape. Okay. Questions number 32. Each lamina of the cerebellum is made up of option A molecular layer, options B Purkinje cells layer, option C granular cells layer, options D all. The right answer is options D, that is all. Okay. Each lamina of the cerebellum is made up of molecular layer, Purkinje cells layers, and granular cells layer. The cerebellum actually consists of a cortex, which is covering that white matter, as well as there's also ventricles, which is filled with fluids. Okay. Uh, that's much for today. Thank you.